I'm glad you all could be here tonight and glad that my internet was cooperating. It looked like it was not going to work for a second there, but it came through. Tonight we have with us Sharon Hayden, who works with the Kentucky Targeted Assistance Program, and Cynthia would know more of the history. She's good at all those details, but I know that we've worked with KTAP for many years, and they help out families in the community with special needs and kind of getting back on their feet. And through both the Mel Moderman Fund and the Swope Memorial Funds and other funds through the church, we've helped provide down payments on cars, I think, and apartments, and paid rent, and help people get furniture and all kinds of stuff, whatever extra needs that people have that the funds aren't covered through KTAP. So thank you, Sharon. And if it's okay, I'll pray us in really fast. All right, let's pray. God, we thank you for this day, for the chance to be together. Guide our conversation and be with us, that we would hear your call to serve your people and your community. We pray in your name. Amen. All right, well, I'll turn it over to you, Sharon. And again, thank you for being here.
Thank you all for having me. The University of Kentucky Targeted Assessment Program, we've been in existence since 1999. It was a collaboration that took a decade. It was between the Cabinet for Health and Family Services and then Community-Based Services and the University of Kentucky Center on Drug and Alcohol Research. So we began a pilot program in 1999, and TAP has expanded 7 times since that inception. The program's successful implementation is ensured by TAP administrative staff, faculty, and 59 targeted assessors, and we are in 35 counties throughout the state of Kentucky. The Cabinet initiated TAP to assess individuals who had barriers that are likely to impede their transition from welfare to work and or interferes with their parenting responsibilities. The TAP assessors provide assessment. We provide referral, pre-treatment, service coordination, follow-up services focused on identifying and addressing substance use disorders, mental health disorders, intimate partner violence victimization, learning disabilities and deficiencies, and other barriers that negatively impact parents and their children. The assessors are available to provide consultation and training to case managers, to other staff, to community partners, and anything to enhance an agency's overall skills in identifying and addressing these barriers. So recognizing the complexity of the problems that these families face, the foundation of TAP services is a holistic assessment. So the goal of the assessment is to capture a spectrum of barriers to self-sufficiency and determine how they can interact. The assessment questions are taken from a variety of tools, including the DSM-5 diagnostic criteria for mental illness and substance use disorders, the Addiction Severity Index, the Conflict Tactics Scale, the Mini International Neuropsychotropic Interview, the Bresler 7, PSTD, PTSD scales, and the Washington's Learning Needs Scale tool. TAP also assesses for physical health problems, legal problems, difficulties with education, employment, and basic needs such as food, clothing, housing, transportation, and childcare. TAP submits a summary report of assessment impressions and makes recommendations for ongoing services, and then works with the participant and case manager or caseworker to facilitate appropriate referrals and assist with engagement and follow through. TAP also provides monthly updates for any DCBS referral sources. So throughout all phases of work with participants, TAP utilizes evidence-based interventions such as motivational interviewing, strengths-based case management, that have been shown to be effective with low-income parents. The TAP model also relies heavily on collaboration with multiple service systems, building relationships with service providers on behalf of DCBS clients, fostering coordination, collaborative care whenever possible. Multidisciplinary advisory councils and other community collaboration groups are established in TAP sites to assist in program planning and staff hiring, and to provide ongoing support and input to ensure the program's effectiveness and continuous improvement. By identifying and addressing problems in the referral process or service delivery systems, these community groups help improve linkages and service delivery among the interagencies. To be eligible for TAP services, clients must receive or be eligible for TANF, Temporary Assistance for Needy Families, Kentucky Transitional Assistance Program, with at least one dependent child and a family income at or below 200% poverty. And in addition to meeting those requirements, the Division of Permanency and Protection must have a child in the home or a plan for reunification. So the majority of participants are referred by DCBS case managers, but community partners also can refer, and that's where you all can come in. So that is our required diagnostic. Sorry, that's our program diagnostic that I have to read to you all of what we do and how our services are implemented. So what does all that mean? What do I do? Well, Mother Teresa said it best. It only takes one person to care to make a difference in a life. And I think that's what we do. We care, we listen, we assess, and then we link. Your mission of having divine solidarity with human suffering and making something beautiful from that which is broken is just a wonderful discussion during this Lent season. And it's just commemorates the community and what TAP services are. There's no greater divine solidarity than being in the trenches, than listening to trauma and human suffering. Just the trauma of the human condition, and listening to that and making something beautiful from that which is broken. So healing that trauma, whether it's domestic violence, whether it's mental health, whether it's substance use disorders, whether it's learning problems, employment, just healing that trauma of broken systems, from systems of the family that's broken, DCBS systems that are broken, court systems that aren't functioning well and are broken. Can you imagine someone saying to you, I'm going to remove your children from your home? You know, how do you build up from that? And I think that's what we do. That's what TAP does. We heal. How do we heal even that new trauma that was created by the systems that are supposed to be helping families? And I tell families all the time, you know, let's just start with ourselves. Let's start with our own families. What can we do? Where can we start? TAP identifies, and the experience with the community, we identify and we devise those support networks within the community to help build up those families. We form coalitions and we sit on them. We access boards and other agencies. Within this community, Hardin County has rich resources. We have access to bring awareness of the human condition. We have education programs. We have Spring Haven domestic violence program. We have Warm Blessings soup kitchen, and we have rooms at the inn. We have Community Action Agency for LIHEAP for emergency assistance and for rental and electricity utilities. We have Helping Hand of Hope. We have Mission Hope for children. We have USDA commodities Feeding America, St. Vincent de Paul. And we have you, First Presbyterian, and we have your foundation. And that's how you serve. Um, and you've asked about how you could help. And I think the biggest part of TAP and assessment, it's not just that monetary. What I want to see and what I encourage every participant that I refer to you is that they link with you and do that mentoring with you all. You all have embraced clients and just I just love to see how they change and how just that little support and someone caring and saying, what can I do for you? What are your goals? Not what DCBS wants. What do you want and how can I help you get there? And seeing those changes and you all providing that support for families is just wonderful. It's just a connection. One of your goals was to build congregational vitality. And I think that that defines our relationship, because I think if we get support systems and support networks in place and we give hand ups and not handouts, I think that's where we make the difference. And we're eradicating that systematic poverty. You know, these families, when we refer them, we ask them to come up with their deposit. We ask them to come up with part of their rent before we even refer them to you all. And then when you give them, I wish you could see their faces when you give them 2 months rent and how that helps support that family and gets them on their feet. It's just amazing. And the gratitude is just overwhelming. Especially during COVID, we can't do that face to face. And I had somebody in the parking lot out here just weeping with your generosity. And so you are so appreciated, and what you do for our families is just, I know it's underappreciated because we don't have the socialization skills yet to get them to send thank you notes, even though I've offered to give them stamps and everything. But that generosity just goes a long, long way. You also had, as part of your mission, was dismantling the structural racism. And that just takes education. I think we have to educate the population. In Hardin County, we had Judge Hall was part of a pilot program called Best Practices. And DCBS was removing children, Black minority children, at a higher rate than even nationally was acceptable. And, you know, that awareness made us take action. And TAP was able to sit on those committees and say, what can we do to change this? If this is the percentage of minorities in our community, why are there so many children of that race being removed from homes? And what formed from that was a minority advisory council and a mentorship program through family court, through Judge Hall. And what a tribute to our community and to society that we accept it. Wow, we're doing a really bad job at this. What can we do to change that and implement it? So we had diversity trainings from technical assistants from the state. And we had that education piece brought in. And TAP helped to do that and helps to coordinate those kind of educational programs for the community. So if you're wondering, what is this medical assisted treatment for opioid disorder use? You know, if you need information on that, how do we help a survivor of domestic violence? Where do we go? What do we do? If you need those resources, TAP is available to help you with any client that you have, with any member of your congregation who is experiencing any of those problems. We will be glad to meet with and talk to and help them navigate the systems that are available. So basically, TAP assesses, we meet parents where they are. We motivate to make change, to impact their life and overcome those barriers and provide those linkages to resources and help them to be self-sufficiency, to meet self-sufficiency. We asked DCBS to give us a testimonial. We met with Permanency and Protection Central Office, and one of our supervisors here in Hardin County, Nicole Hunt, had this to say about us. UK TAP is a true blessing, not only for the ease of the referral process for the social worker, but more importantly for the individuals that are able to benefit from the holistic assessment the program provides. The individuals that are referred often feel listened to by our UK TAP workers. It keeps the individual with one assessor rather than several assessors at several different providers, depending on what is requested of them. UK TAP removes the barriers of financial strains, transportation needs, and scheduling conflicts for the individuals referred to them. In addition, workers are able to receive detailed reports in a timely manner without hesitation that sometimes workers face when dealing with outside facilities. Individuals served by UK TAP appear to be more successful in completing the requested assessments that are part of the case plan tasks and others that seek assessments elsewhere. Hardin County is very thankful to have UK TAP services in addition to the wonderful workers that provide it. So I'll let that testimony speak for itself, and you all have been just so enriching to us. TAP does not have funding or funding sources. We link to community resources. So we have no monetary availability to do anything. Curriculum that I have collected for pre-treatment education, I have written grants for to even obtain that. So we rely on community and community support and community networks to help us to engage our families. So I want to part with words of wisdom about secondary trauma. Because we're all caring individuals, we need to care for ourselves and take care of ourselves. So as we're helping people and we're listening to these traumatic events of their lives, make sure you take care of yourself. That self-care is so important, and be mindful of that and what your needs are, and ask for what you need. It's okay, especially now during COVID. It is just amazing how people are functioning, especially people with young children. Hats off to you, trying to do school schedules and work schedules. It's very challenging times for everyone. TAP will try to link you up to anyone if we try to keep informed through interagency meetings of how services are delivered now. Mostly everything is telehealth. We're using Zoom, we're using Skype, we're using phone interviews to accommodate the CDC recommendations right now. And we've lost our home visits, which, that's where we make the greatest impact is in that home, in their space. And you can see a family, as they are and meet with them. So it's been very challenging being on the phone. But we had a regional meeting recently, and most of the assessors are saying, because we're on the phone, we take time and we ask more questions, and we can't read body language. So we're really saying, oh, you hesitated there. And we're getting better assessments, which is amazing. So out of all of this, we can actually say that we're doing better assessments for our clients and better referrals. So that has been wonderful. So that's what we do. Are there any questions or anything that you always wanted to ask about services or service providers or experiences that you want to share?
Sharon?
Yes.
Jan, thank you for all your organization does. Yeah, I do have a question about follow-up. And you may have said something about it. How long do you follow families that you have provided services for? And what kind of results do you get from these follow-ups, and how do you do that?
Well, we're doing everything phone interviews or Zoom contacts. So we are allowed to have a case open if DCBS closes the case up to 12 months after. For our learning disabled clients, I've worked with them for 1 or 2 years to make sure that they are linked up to the right, they have the right resources and networks of support. So we always do follow up, even if we finish assessment and they are engaged in services. Before we inactivate a TAP case, we are required through the program to provide a follow-up call. Are there any other resources that you need? So even after we have them engaged in services, we still do that follow-up. We also do data because it's University of Kentucky. We're collecting data, actual data on barriers to self-sufficiency. So that data also includes that they may be part of a research project follow-up where they may be asked interview questions again. We do quarterly and annual reports to the cabinet about barriers to self-sufficiency in the state. So we really have a large leeway in working with clients for however long they need support. The average, I think when I started 10 years ago, I think they said 3 to 4 months we do intensive case management with a family, and that was the average case. So the assessment itself, TAP is required. We receive a referral and we have deadlines that were established between the two agencies. So we have 30 days to make first contact. We have 30 days from that first contact to do what's called the baseline survey, and that's that assessment tool. From that assessment tool, then we meet again and do that psychosocial piece where we're asking all those intrusive, invasive questions. If you go to a mental health agency or a substance use disorder clinic, they're going to get about 45 minutes of assessment. Our assessments are 3.5 to 6 hours and some longer with learning disabled clients. So it's a very intensive holistic process. So just the assessment piece itself, from that 30 days of baseline survey, we have six weeks to have a completed assessment summary. So we have a contract to complete an assessment. So we work with the clients just diligently. And then we're required at least 1 monthly contact. Some clients, domestic violence victims, I will talk to them on a weekly basis, sometimes twice a week, until safety concerns are gone. If you have someone who's in active addiction and not able to get a bed yet in an established facility, we will follow up and talk to them and just try to link them to whatever resources, whether it's intensive outpatient services until a residential treatment program opens up. So we'll just follow them and go as we are as inintrusive or as supportive as they need throughout the process.
Thank you.
Hi, Sharon. This is Joy.
Hi,
I was wondering if you can speak to how many families in general that you work with from Hardin County and then statewide.
I can't give you statewide numbers. I just had my performance evaluation and I served 78 clients who completed baselines. A lot of clients call and we give them resources because they're in imminent crisis at that time, and we don't get a baseline completion. So roughly I can say, and we have at least 35 non-TAP clients that actually are provided resources. So we're looking probably at 125 to 150 clients that I personally serve in Hardin County.
And are you the only person?
10 years ago, it was closer to 200. Referrals have been down.
So are you the only assessment coordinator or person for this area?
I am not. Lee Morris has taken a supervisory position and she carries a half caseload. So she will carry, right now I have 28 clients and she'll carry about 10 to 15. And she also does about 78, 79 completions a year annually.
Thank you. And thank you for being here tonight.
Oh, you're welcome. Thank you. And statewide, I can get that data for you if you want it. I can send you our annual report.
Yeah. Sure.
Which you'll read between making dinner and putting the kids to bed.
Now, we serve in Hardin County, also in the Salt River Trail. We have Melanie Carter in Nelson County. We have Bullitt County. We have Laura Boda in Bullitt. Our closest cities, we have Jefferson County, and I think there's 6 slots. I think 4 of those are filled right now with assessors in Jefferson. And we also have Warren County and Barron County. So those are our closest regional assessors.
Just a little background. Dottie Hanson used to do all this. When she was our missionary, she used to do all these assessments. She would contact all the agencies. And when she retired, the church did a real thorough search as to find out who would do this, because we did not have the ability to really interview, assess, or know what was available as a church. And so the church was thrilled when they made the connection with UK TAP, because they are kind, they're thorough, they are, like you say, it's more of a hand up instead of a hand out. And because you had so many agencies in the area that you would rely on to service and help people, that was one of the other reasons that the church decided to go with UK TAP. And they're very, I can't think of the word right now, but they're very judicious in asking for assistance. In fact, I think at one point we hadn't heard from them in about 6 months. So I called them up and I said, is everything okay? Is there anything that you might need? And she said, no, not at this time. But a couple of months later, they did need some assistance. So I just think that says a lot, that you don't constantly go to the same sources. They really go through a list and to get the best help for the people that they work with. So
yeah, we're not going to use your pot of money if somebody else can provide it. You know, we use all the access, we access any resource available, and when that has been just depleted or there's nothing left for our clients to do, and they have to work their case plan. They have to be making those changes in their lives. And they have to show us that, you know, before we ask for that help. And Dot Hanson, yes, I'm an old dinosaur. I've been a service provider in this area for 35 years at every agency that's here that's a helping agency. So Dot Hanson is just a legend, and just a powerful woman who just empowered other women and other agencies. And it's just wonderful to have known her and to see how Hardin County has grown and how service providers have coordinated and collaborated in all these years, because it used to be one agency would only do this and one agency would do that. Now we talk to each other and we collaborate, and we do have the best possible systems and networks in place. And that's a wonderful change to see.
thank you.
Sharon, last week we heard from Lynette Kennedy at the Hardin County School System and her program working with the student families that are about to be or already homeless. Do you work with many of the families that come through her program?
We have referred to her program numerous times. I've not had any referrals from her, but we have referred to her. So yeah. And I think she's growing. She's trying to get the funding for that position. There was no funding when she first started that position, and she presented and we chatted at one of our interagency meetings. So I'm hoping that she's getting the resources she needs. Housing is a huge barrier in Hardin County and as elsewhere, most of our counties in the state. And it's becoming less affordable. Affordable housing is even harder.
Yeah,
So
that's
you-
something. Oh,
Oh,
go ahead.
sorry, go ahead. Go ahead.
No, you go, Joy.
I was going to say, so you only work with families with children. Is there a similar type agency that is more cohesive and more collaborative like you that works potentially just with adults or couples if they're in a similar situation but don't have children?
You know, with any of those, I think any barrier that they have, whether it's mental health, substance use, domestic violence, learning problems, there's grant funding available. You know, through if they don't have money for or don't have insurance, there's case managers through KIPTA, through Lincoln Trail Ad. There's senior programs through Lincoln Trail Ad. But as far as a holistic assessment, they would have to go to a mental health agency for that. And most mental health agencies with the Affordable Care Act, they have a case management piece, which is wonderful because now you have supportive services in place so that they can help with those additional barriers as well.
What did you say it was? Lincoln Trail?
Lincoln Trail Area Developmental District, the
oh.
Lincoln Trail Ad. Yeah. They have senior programs, senior programs for, I think they have to be 200% poverty. It might even be higher. But they have weatherization, they have senior in-home care, senior meals, all those things.
What is considered poverty level now?
200%. We just changed it. Let me pull my referral form up. Well, I said I had it. The 2021 federal guidelines for 200% poverty for one household member is $25,760 an annual. For two, it's $34,840. For three, it's $45,920. For four, it's $53,000. And for five, it's $62,080.
Wow.
So it's really high. It's actually pretty high.
Yeah, it is.
I know. Yeah, right. Most of DCBS workers, incoming workers, are probably eligible. You know, it's sad. And military, we get a lot of family support in the military families who are eligible for SNAP benefits, the food program, food stamps, and so it's amazing.
Thank you.
So how do we refer to you? I remember, I don't know, a couple weeks ago, a month ago, someone was saying to me, oh, my hairdresser's sister is like really struggling. She's got 2 kids and, you know, needs a place to live. But she just can't find anything for less than $600 a month. And that's all she can afford. And I was like, well, she sounds like she qualifies for KTAP. this person is really involved in the community, but had not heard of you all. And I was like, oh, you need to know. And I guess I should have just called you. But anyway, how
You
do we
can
refer
call
people
and
to you?
email. All I need is the name and phone number. I can do the referral form itself. If you want a referral form, I can email you that as well. Yeah, you can just give us basic information and we'll contact them and see if they're a good fit for the program and if they want to do the assessment. And they can just call for resources. If you all have somebody who's in need of resources, you know, TAP, we do what's called non-participant data as well. So we collect and we can provide resources without doing assessment.
That's good to know. And so we could do that even for families without children potentially.
Yeah, we can do consultations anytime. You've got a family, you've hit a brick wall and you just don't know where to go or what to do with them. You know, two brains are better than one. We'll talk and see what we can come up with, and who knows who in the community that can provide a service.
Yeah. And we have encountered this housing issue a couple of times, even in just the past year. I wonder, you know, what do you do? Because that seems like a huge problem. It's just like there's nothing out there. You know, how do you help a problem when there's like no solution?
The biggest solution I've found, and what I do is ask clients, are they willing to relocate? Because if you go just a county over in you know, Hodgenville, LaRue County, you're close to E-Town, but you have, you know, your rent's $450 for a house, not $750 or $950 now. You know, these apartments that were $350 are now, you know, $750, $850 a month. So yeah, I mean, I asked, would you consider relocating? And then kind of push them that way. We've had, and you helped domestic violence victims, actually 1 or 2 of them, to move to Mumfordville, which they have apartments for $325 and they're nice. So yeah, I was Hart County, and you're what, 30 minutes away from E-Town, and so yeah, it's you know, Hardin County with Fort Knox, we expected all those troops to come in and they were supposed to stay here and they didn't. And what happened was when Human Services came into Hardin County, they moved from Maryland, Virginia, DC area, which is where I'm from. And you know, the cost of living there was extremely high. And I think our banks and our realtors saw that opportunity. And, you know, we've got our affordable housing is just gone now. And unfortunately, a lot of our landlords have aged out. And people that Dot Hansen and I used to call, who had 4 or 5 houses for $350 a month, and we would slide our clients into those houses, they're just not there. That resource, that valuable, you know, mouth to mouth, person to person, we just don't have that anymore. So, and the subsidized housing list, it's not even opened. I think it opened for like a 2-week period, and we didn't even know, we weren't informed that it would be open. So we didn't tell our clients, get on there and do the pre-application. So this last time that it was open, we missed the boat on that for a lot of our clients. The last client I had placed in subsidized housing and Section 8 housing had been on a waiting list for 9 years.
9 years?
9 years she had waited.
Wow.
Is there any conversation of subsidized housing or low-income housing for the Hardin County area? Is there even like I said, just somebody saying we need to be doing something as soon as we can?
I think we're all talking about it, but I don't think there's any backers or any contractors or anybody or government programs that are going to step in.
So we're talking around the issue instead of
addressing. Yes, just like
Okay.
public transportation. You know, it's very political here in Hardin County, and we don't have buses because we have TAC and other, agencies. So we don't have.
So we should start visiting city council.
Yes, ticket it.
Visit city council and say, I have an issue with.
Well, we did the homeless count years ago, and I worked at Passages Transitional Housing for women who had substance use disorders. And Lincoln Trail Ad had actually did a survey about public transportation and the need for it. And we got all this support from all the service providers saying, yes, we need a bus. Just get one. Go to Radcliffe, go to E-Town twice a day. What a big help that would be. And they said that they just did not have an issue with transportation in Hardin County. Now that was many years ago. I've been in this position for 10 years. I've been at the cabinet for 12 and a half, almost 14 years in this office. So I think we do. We did bridges to poverty trainings out here. We've done a lot of the groundwork, but it's just, getting everyone on board to say, this is what we need and how can we best serve our clients.
Okay, thanks.
Mm-hmm. Anybody else? Anything else?
Everybody's so quiet tonight. I know somebody who's military family, and her theory, I don't know if this is true or not, but her theory is that because and she was running into it even just as like a middle class family trying to find an affordable like house to buy, that her theory was that because the people who work at Fort Knox get a certain amount, and not people who work there, the people who are, I guess, in military, right? They get a certain amount of housing
subsidies.
Yes. And so, it is known then how much is possible that people can pay for rent and for housing, I guess, too. So
yes,
that was her theory, is that kind of like pushes prices up.
What I've found now, especially during this crisis, is that it's not our impoverished families that are really struggling right now. It's our middle class families who have lost positions and they don't know where to go for resources. So I've had a lot of educated and, linked people that had great jobs and lost them. What do I do now? So I think sometimes our 200% poverty clients, they're aware of services, and now there's this whole segment of the population that's struggling with food and don't know where to go for access to food, who don't know where to go for affordable housing. With one job, what do? You're going to lose your house, and just what do we do? Do we give up one of the cars? Do we do that? But then if I get a job, I'll need the car. So there's a lot of people struggling right now with those kind of things that have never faced these issues before, prior to COVID-19. So I'm finding other families that meet 200% poverty now that were middle class families.
Have you all had more referrals because of COVID, like during this time?
Actually, statewide referrals are down in metropolitan areas of all places. I have met all of we have 6 to 8 referrals a month that I take. That is my allotment for the month, and my maximum is 9. And I have had no problem since COVID making my referral ratios. So Hardin County, even with its DCBS tends to have lots of overturn, they still make referrals to TAP. I think they've embraced us here, which is great. I found clients actually, they like just talking on the phone, and they'll engage in mental health services not going into an office. It's been very interesting, the motivations and the movements of engagement with service providers during this as well. It's been a learning experience.
You said that your service is in 35 counties. What are they doing in all the other counties?
All the others, they do the same assessment. We do the exact same assessment statewide. We also added 25 new positions to the TAP opioid use disorder program. So there's 25 other TAP assessors who are actually doing a supplemental, and it's basically reporting on opioid addiction issues. So we do the same thing. Some counties have less resources, and the TAP people are usually hired who have degrees in social work or degrees in psychology, so that they can provide the services in those rural areas that do not have resources. So we assess, we link, or we do pre-treatment education, or we do the work ourselves. So that's what we do.
But
We're trying to get them transportation to move to the cities where they can get those services.
University of Kentucky rather than the state welfare service.
Yes, we are. I am hired by the University of Kentucky, the Center on Drug and Alcohol Research. And so we are contracted with the Cabinet for Health and Family Services.
Okay.
Most of our offices are in their offices.
Yeah. And not everyone you work with struggles with drugs or alcohol.
No, they only have to have one area of the 4: mental health, substance use, domestic violence, or learning problems.
And that's to be a TAP. Go through the assessment. Yeah.
Yep. Just to participate. The more barriers you have, the higher the priority. Also, if you have children under 5 that are high risk, that's also a priority referral for us.
I read that Kentucky leads the nation in child abuse and neglected children. That's not really your area.
We do. Most of our clients do come from permanency and protection. They are open cases where children have been removed or are in the home and at risk of being removed. So most of our referrals are from that source, rather than the family support or community service providers, other community service providers. Yes, Kentucky is the leader, unfortunately, in that. And Hardin County nationally removes more children than anyone else in the United States.
Interesting. I wonder what that is about.
It's different. And I guess the TAP perspective, when we gather across the state, it's different. The dynamic is different because of the leadership in each county. So that atmosphere of leadership has a lot to do with that. In Hardin County, they remove children. In Nelson County, the children can be out on the road playing and they won't remove them. So it's really unique. It's a unique experience. I love the data part because I've been doing this for so long. I started in Bullitt County in an Even Start home education program, and we taught adult ed, parenting, early childhood skills. And just seeing how that has changed over the years, and that now we have the data on barriers to self-sufficiency, and we actually can say, this is what this family needs, this is how we can help them. It's wonderful to see that in my lifetime.
So Sharon, did I understand correctly? You say Hardin County removes more children from families than any other county in the nation?
Yes, we have the highest removal rate, which was why Judge Hall did a pilot project on best practices for family court and TAP was part of that. We sat in all the committee meetings. Fayette County also did best practices, and one other county, I think maybe in Owensboro, they also did a pilot program on best practices in family court.
So is that because we've got a huge problem in Hardin County, or is it because we do a better job of protecting children?
I think we identify it, recognize it, and remove children. And we have a plan that we do what we call concurrent planning with the cabinet. So at the same time a child's removed, they expect permanency within 12 months. So when children are removed within 12 months time, they have to have a permanent placement. That was the law. I want to say it was House Bill 301, I think it was, that they initiated a few years ago. And so that I think that just made it more acute, just the situation more aware and more acute in placement and removing kids and getting them. And unfortunately with substance use disorder, you can imagine, it takes 6 months of clean time to get a child back in the home by most of the family court judges. And it's just that you have a 12-month deadline. It's almost impossible to get someone clean without relapse, in housing, stable employment, and ready to have those children back.
So where do they go?
Foster care. And there is a shortage of foster care families.
Yeah. Sharon, is the biggest removal of children drug abuse or substance abuse?
It is. It's domestic violence and substance use.
Well, I have to wonder, many of these are unused, unwanted children, just accidental pregnancies and a lot of that aspect.
Well, I haven't seen a parent that hasn't wanted or loved their child, but I think they just didn't have, it's that intergenerational poverty, that intergenerational substance use, and it's co-occurring disorders. So usually you have someone who has experienced trauma, and then they have a substance use issue to cover that trauma. So it's usually a mental health co-occurring disorder that led to the substance use in the first place. And I think recognizing and identifying that, and then supporting that client, to heal that trauma, you've got to heal it to move to a better place. So.
And you read about single mothers that have a boyfriend, and the boyfriend has no attachment to the child and does terrible things to him.
Yes. Yes. But we do have Silverleaf, that is our sexual assault center. I forgot to mention that resource. They are just absolutely phenomenal. I can't say enough about Silverleaf services. It's for any victim of sexual assault, their children, or family members who are dealing with that. But prevention is the key. We have to recognize and identify it, and we have to educate parents on it.
Thank you.
You're welcome.
Well, unless anyone has any other questions, thank you for being with us so much, Sharon. I learned a lot just in the last 15 minutes. And I'm sure I'll be calling on you now that I have a face to a name and know that I'm welcome to do so. And we're really grateful for your services as a church, because we know that when we're contributing to a K-type need, that that family is also supported by you and is connected to everything else that they need. So then that money is really going to go somewhere far to help them move along in their life. And none of us are social workers, so we're glad that you all are that great resource for us in the community, and that all the resources out there. We're grateful for that.
Well, thank you very much. We appreciate you and can't say enough about your services for our support for our clients. It's just phenomenal what you all do and the changes that you make in their lives. It is God's work.
Well, we're glad to hear about that and happy to help in whatever ways needed in the future. Any other questions or comments before I send us on our way? Oh, Joy, I see your face now. It was
Thank you, Sharon, for being with us.
You're welcome. Thank you for having me.
all right.
Yes, thank you so much, Sharon. We appreciate it.
Hi, Chatham. God bless you all. Go in peace to love and serve the Lord.
Thank you.
Thank
Bye-bye.
you. Bye.
Bye.
Bye,
Bye.
Chatham.
Bye, sweetie.
Bye-bye.
Bye, David.
Bye.
Hi, Adam.
Bye.
Bye-bye.
Bye.